There is one disclaimer I need to make about doing keto though. You need to make sure your body can handle fat digestion. My wife is a perfect example of someone who initially couldn't do it. Her gallbladder wasn't working effectively, so she couldn't properly digest all the fats. This is why I mentioned the gut program. The gut program can get everything working right first before you make the transition so that your body can do it efficiently. If you don't have a gallbladder or simply can't wait to start, there are 2 supplements I recommend for this: Biotics Beta Plus and Biotics Beta TCP. If you had your gallbladder removed, Beta Plus is a must. It will basically act as your gallbladder would. So take 2 of those with each meal. If you do have a gallbladder, then do not take Beta Plus. It could create a dependency. So if you do have a gallbladder, Beta TCP, take 2 with each meal. It will help your gallbladder work through the fat digestion. ADHS from Biotics can also help with normal adrenal function, which also plays a role in blood sugar. Another big thing to be aware of is what is known as the keto flu. It is not uncommon for some to get sick when they first cut the carbs, and the reason for this is dehydration. Carbohydrates do help your body retain water, so making sure you stay hydrated is huge. Biotics does have an electrolyte supplement. One other trick is to take a salt shot. Take a shot glass of water, pour 1/8 of a teaspoon of pink Himalayan salt in and take it. You can wash it down with more water if you like. The rule of thumb for getting enough salt and water is about 1/8 of a teaspoon of salt per quart of water you drink per day. And you can Google water intake calculator if you need. And one other thing to be aware of with keto is for women. Male and female hormones operate on different cycles. Male hormone cycles happen on a daily basis, while female hormone cycles operate on a monthly basis. So keto tends to be easier for men than women, but can be just as beneficial for women in all states. So even during pregnancy and breastfeeding. It has been shown to be especially beneficial for women who are trying to get pregnant and for women suffering from menopause. The reason for this is because keto causes a decrease in estrogen production. When trying to get pregnant, having proper balance of estrogen and progesterone is essential. So what's the catch, I'm sure you're thinking? A week leading up to the women's menstrual cycle, progesterone secretion is in full swing as it prepares a woman's uterus for pregnancy. This change can lead to some serious sugar cravings for energy. So it is advised not to start keto during that week before your menstrual cycle. The best time for women to start keto is the week following her menstrual cycle. This will give your body enough time to fully get into ketosis before the time rolls around again. Some other resources we have is an actual keto program that will give you a ton of information, as well as supplements that will help you keep hydrated and get you into ketosis, avoiding those keto flu and fatiguing that sometimes happen when you're first starting. And then we also have shopping lists and recipes to make things easier. One of the best resources for keto is a good textbook though, to which I recommend Keto Answers by Anthony Gustin, who is also a chiropractor. So quick recap on if you plan to start keto. Number 1, is my gut health in the best state to transition to keto? If you don't know, take my gut health survey. If you're good, you're good. If your results are mild or moderate, I would consider doing our gut health program, but it's not a must. If your results are severe and or you have diabetes, you should absolutely be doing our gut health program first. Number 2, do you have a gallbladder? If no, get Biotics Beta Plus and make sure you take it with each meal if you are going to transition to keto. If yes, then check out my food sensitivity testing video and test heavy fat foods to see how your body will handle them. If you have trouble digesting fatty foods after you transition to keto, then get Biotics Beta TCP and make sure to take 2 with each meal to improve that function as you start. Number 3, remember to stay hydrated. Drink plenty of water, take some healthy electrolytes, and not Gatorade or vitamin water, but a good healthy source, or take salt shots as needed. And lastly, have a plan. If you need help with one, again, we have a great program, or get the book Keto Answers by Anthony Gustin. Thanks again for listening. I hope this helps you reverse your diabetes.